Struggling to understand compassion, fatigue, and healthcare? This quick breakdown will make it finally click in minutes. If you've ever finished a shift feeling completely drained, like you have nothing left to give, this video is for you. Welcome back. Today we're breaking down compassion fatigue healthcare in a clear, practical, nursing-focused way. This is the beginner's guide I wish I had earlier in my career. Here's what we'll cover. 1. What compassion fatigue actually is. 2. Why it matters so much in nursing. 3. The warning signs, the causes, and what you can actually do about it. By the end, you'll be able to spot it early and protect yourself. Let's get into it. So let's start simple. Compassion fatigue is the emotional and physical exhaustion that comes from caring for people who are suffering. Think of it like this. As a nurse, you give empathy all day, every day. But empathy isn't endless. It's more like a battery. When you keep giving without recharging, that battery runs flat. Compassion fatigue healthcare explained in one line? It's the cost of caring too much, for too long, without enough support. And here's the key thing. It's not weakness. It's a normal human response to constant exposure to other people's pain. Now, why does this matter so much in nursing and healthcare? Because you're on the front line of suffering every single shift. You comfort scared patients. You support grieving families. You make life or death decisions while running on empty. When compassion fatigue sets in, it doesn't just hurt you. It can affect patient care, teamwork, and safety. A burned-out nurse is more likely to make errors, feel detached, or leave the profession entirely. So understanding this isn't just a well-being topic. It's a core clinical skill, just as important as the practical ones you learn in nursing education and healthcare training. If you felt this way, stick around. The next part is where it really clicks. Let's talk about the warning signs. These often creep in slowly, so they're easy to miss. Watch for these. Feeling emotionally numb or detached from patients. Dreading work or feeling cynical about it. Constant tiredness that sleep doesn't fix. Trouble concentrating or remembering things. Irritability with colleagues, patients, or loved ones. Headaches, stomach issues, or getting sick more often. Here's a quick myth versus fact. Myth: if I cared enough, I wouldn't feel this way. Fact: it's often the most caring nurses who experience it most. Your compassion is the reason, not the problem. If you nodded along to any of those signs, you're not alone. And it's something you can manage. So what causes compassion fatigue in the first place? A few big drivers stand out. High patient loads with not enough time. Repeated exposure to trauma, death, and grief. Long shifts and short staffing. Feeling unsupported by management or the system. Some people are at higher risk too. New nurse students often feel it because everything is unfamiliar and intense. But experienced nurses aren't safe either. Years of giving can quietly wear that battery down. The truth? In a demanding healthcare environment, almost everyone is at risk. Knowing that helps you take prevention seriously. Now for the good news. There are real practical things you can do. Think of this as your compassion fatigue healthcare tutorial for staying well. First, name it. Just recognizing what you're feeling takes away some of its power. Second, set boundaries. You can care deeply and still say, "I need a break." Both can be true. Third, protect your basics. Sleep, food, water, movement. These aren't luxuries. They're how you recharge that battery. Fourth, debrief. Talk to a trusted colleague after a hard shift. Carrying it alone makes it heavier. Fifth, use small resets during work. A few deep breaths between patients, a quiet minute in the break room. Tiny pauses add up. And finally, ask for help when you need it. Counseling, peer support, or your employee well-being program. Reaching out is a strength, not a failure. Let's make this real. Picture a nurse on a busy ward, 3 patients deteriorating, a family in tears, and no time to even drink water. Without coping strategies, that nurse goes home empty, dreads tomorrow, and slowly starts to detach. With them, she takes a breath, debriefs with a colleague, and protects her energy for the next shift. Same job, same pressure, very different outcome. That's why this matters in everyday practice. Managing compassion fatigue keeps you healthy and keeps your patients safe. It's a skill you'll use your whole career. Let's recap quickly. Compassion fatigue is the exhaustion that comes from caring for people in pain. It matters because it affects both you and your patients. Watch for emotional numbness, dread, and exhaustion. The causes are heavy workloads, trauma, and lack of support. And you can manage it with boundaries, self-care, debriefing, and asking for help. That's compassion fatigue healthcare for beginners. Explained simply, you give so much. Make sure you protect yourself too. If this helped it finally click, do me one favor. Comment below and I'll know to make more nursing well-being guides like this one. And subscribe so you don't miss the next video. You've got this. Take care of yourself out there.